And next I'm going to bring up my colleagues Claire and Tammy for our talk on the psychosocial aspects of genetically defined EDS. So we should have some slides. So we have no disclosures. So you've already heard about the UK EDS Diagnostic Service, and Claire, Tammy and I are 3 genetic counsellors that work in the Sheffield service, and our role is to help people understand and adapt to the medical and psychosocial and familial aspects of genetic conditions. So I can't say it, but what does psychosocial mean? So essentially we're talking about both the psychological of our mind and the social aspects of these conditions. That's our thoughts, our feelings, our behaviours, the family, friends and society around us, and how we adapt. So between the 3 of us, we have nearly 30 years of experience in supporting people and families with genetically defined types of EDS. And this presentation is all about the psychosocial impact of these diseases. So we thought we'd present some case studies. They're not specific to any one individual, but they're based on our experience. And you might recognise some thoughts and feelings that you've had through these case studies, or you might not, because we're all unique and we all have our own experiences. So I'm going to hand over to Tammy for the first case study.
Hello everybody, I'm Tammy. So my case study is about being the first in the family to have a rare diagnosis. So I want to introduce Sophia. Her mother had a very uncomplicated pregnancy and a relatively normal birth, but they noticed that she was a bit more floppy than her siblings. She had this incredibly soft skin and her joints were very bendy. Over the first year, they noticed that she was a bit more delayed in her sitting and she didn't walk until she was almost 2. And then they also noticed that she started to have quite an unusual curve in her spine. So naturally, the family started asking questions, and these are questions that we often receive. So usually, why is my skin more fragile than others? Will my child need more support in school or other services going forward? And will more future children, if I'm thinking about that, will they be affected or be similar? So here in the UK, usually the family doctor will then refer on to a paediatrician or a geneticist. And usually the first thing they do is take a medical and family history. So for the purpose of the further talks in this session, I just wanted to go through what a family tree or a pedigree is for those of you watching online and not seen one of these before. So without a pointer, I'll try and talk it through. So there's 2 generations in this pedigree. The top line are the parents, so circles are females and males are squares. And the line on below is their children. So Sophia is the second child of 3. And usually the clinician will shade in the person who's affected, and they might put an arrow there to show who they're seeing in clinic. And they might annotate the diagram. So here I've just put Sophia, and she's age 4 when she sees the paediatrician. We can draw family trees that go into multiple generations. So in this particular one, we can see that the mother has a sister. She's been shaded in because the clinician's wondering whether it's relevant. The aunt of Sophia has got a brain aneurysm, and then she's got a child as well. So usually what happens next is they start the diagnostic journey, which is a process I'm sure everybody's familiar with. And we all know that results take often a very long time. And it's normal to feel a real mix of emotions while going through this process. Families communicate to us that they feel excited that they might get a result, but also anxious, fear, and also lots of concern. And often there's a lot of worry about if something's found, will the child be labelled, and what does this mean? So there's a lot of literature out there and research into what the psychological effects are of children who receive a genetic diagnosis. I can't go into all the detail about it, but overall there's no long-term adverse effects, and overall better quality of life for a child if they're diagnosed early. And there's a lot of uncertainty in the process, and that's where genetic counsellors often come in to talk through the families and kind of go through what all this means. So the questions we get asked all the time is, how long will results take? Will something be found? This is completely normal, so I just want to reassure everybody out there. And again, the research backs this up. Things that I recommend for families going through this uncertain period is try and learn more about the process. What are the clinicians testing you for? What they're testing your child? I try and empower people to ask questions. There's no questions too big or too small. I encourage families to focus on the things within their control. If your child is interested in a certain field or they like crafts, encourage them to go down that process. Move forward with other specialities where you're waiting for that genetic result to come back. Advocate for your child's strengths, like I just mentioned, and of course seek support, not just from your medical team, but the charities and support groups like EDS Society. Along the way, I'm sure lots of you watching have had normal or negative results, and again, all the emotions that you feel about this are completely normal and understandable. Disbelief, anger, sadness, frustration. I've talked through a lot of families with these feelings. Historically, as you all know, genetic results can take over a decade to come back. It is getting better, but there's still lots of genetic unknowns. And I just want to acknowledge that lots of families do not receive a genetic result for their loved ones, and this can be very tough as well. So for Sophia and her family, I'm not going to go into this in detail, but after several years, they do actually receive a diagnosis of kyphoscoliotic EDS, and this explains why Sophia seemed to be the only one in her family who had this diagnosis. But that just starts the journey often. So for Sophia's family, they feel a lot of relief. They finally have a name for the condition. But this is the new normal for them. What does this mean? There's new highs and lows. Lots of my colleagues are going to focus on this, but we recommend a lot of self-advocacy and kind of working through the new challenges, especially for something like kyphoscoliotic EDS, where lots of people have not heard this before. Final thoughts, just for me, I could keep on talking about this for a long time, but I think it's important for when you're receiving a new diagnosis to access accurate information. Remember, you're not alone, there are other people out there. Speak to your medical team, and like I said, ask all those questions. There's no question too big or too small. Utilize local services, ask all those questions. Particularly for rare conditions, it's very useful to have self-advocacy skills. And my colleague Juliet will talk about this more in this session. Having a rare diagnosis, as you all know, doesn't impact the person, it affects the whole entire family. So again, my colleague Claire and Sabine will talk about this more. And I think it's important not to forget, be kind to yourself. It's important to have some self-care. And I'm going to pass over to Jess to continue the story.
Thank you. So my case study is about someone who's now an adult who has had a diagnosis, in their case, of classical EDS since they were a young child. And it's based on my experience of talking to people of all ages with this diagnosis, but also I've drawn on a webinar that was put on by the Marfan Foundation about reprocessing a condition as an adult and the research on classical EDS that we heard about earlier in this conference by Ruth Nicholson and Margaret Warren-Perry. So it was excessive bruising and skin injuries that first led to Hamza's diagnosis of classical EDS at the age of 5. He was seen with his parents and the diagnosis was fully discussed, and advice was given on avoiding injury and what to happen if he had a skin injury. And they talked about what this diagnosis would mean for Hamza as he grew up. Following the diagnosis, there was support for Hamza's parents, and Hamza's parents supported him. The family were very worried about Hamza having skin injuries, and Hamza was also keen not to get injured, especially after having a large wound stitched on his left knee at the age of 7 when he fell in the school playground. That had been particularly traumatic. Even with the diagnosis, they found it hard to explain to medical professionals in accident and emergency what classical EDS was. As a child, Hamza wasn't too self-conscious about his scars. He wore trousers rather than shorts, partly to have layers as much as possible for extra protection. He didn't want to get injured, so he used to avoid activities that he thought were risky. And sometimes his friends would ask him why he couldn't do something, and he didn't always know what to say. Sometimes he'd just try and laugh it off. Sometimes he'd say, because I don't want to end up in hospital, and that was true, but he wasn't sure if that made people scared, and he didn't want to be treated any differently. As a young teenager, Hamza felt aware of his restrictions, Sometimes he felt upset or annoyed that he had to deal with this when others his age just seemed to get on with things and do whatever they want. And again, he didn't want to be different. He was also worried about sort of making his own choices. He wanted to do this, but he also didn't want to get injured. His parents were supportive, but he felt like they weren't giving him the same freedom as other friends his age. And sometimes he just wanted to rebel against his parents and ignore all of their advice. He wanted to go swimming with his friends without worrying about his scars. And sometimes when he talked about his skin, he could just kind of, again, laugh it off, like, isn't my skin so stretchy? Aren't my scars impressive? But sometimes he would feel self-conscious, and he was quite happy to keep his knees covered. His close friends were good, and he could talk to them, and sometimes they helped him to think of activities that he could join in with without kind of extra risk, so he didn't feel left out. At the age of 17, Hamza had lived with the diagnosis for over 10 years, but he realised he didn't really know why he had classical EDS. He was trying to work out what he should and shouldn't do, and he felt unsure. Was exercise good for him? Was it risky? Did it make things better? Did it make them worse? He felt like all his friends had more energy than he did, but he wanted to do all the things that they were doing. He just didn't want to get injured. And he was getting quite good at risk assessing, and he hadn't been in hospital for quite a few years. He understood the inheritance of classical EDS and was aware that he could have children with the same condition. And he wasn't really sure what he felt about that. And in thinking about that, he kind of had to think about how he felt about living with this condition. As an adult, Hamza realised that most of the information he'd had come from his parents or the internet, and the internet could be confusing. There were so many different types of EDS. And there are some things that we don't want to ask our parents, or our parents can't answer for us. And Hamza wasn't really sure what he wanted to know. He just wanted to have the same information that his parents had been given when he was diagnosed. So through Hamza, I'm just sort of trying to show the impact of a diagnosis made in childhood on that person as they grow into their adult self. Many adults with genetically defined EDS won't remember that very first appointment when they were first diagnosed, if that happened in childhood. And it's just kind of assumed that a diagnosis is normal when they're adults and they've lived with it for so long. But sometimes we do need a bit of time, space, and support to get our heads around a diagnosis and to reprocess that information as an adult. So it is okay. It is okay to ask for your own appointment as an adult to find out more about what a diagnosis means for you and to ask any questions for yourself. I'm going to pass over to Claire for the last case study.
Thank you very much. So my particular interest is looking at how we can support families to communicate about a diagnosis of vascular EDS, both within the extended family and also particularly between parents and children. And that's something that we are asked quite frequently in our clinical work, but it's also something the charities have approached us about to provide more support for families in this context. So my case is really focusing more around family communication and supporting families when they've got a diagnosis of vascular Ehlers-Danlos syndrome. And I've recently embarked on a PhD to produce tools and frameworks to help families to talk more openly with their children about a diagnosis. So I want to use the example of Sally to highlight some of these familial implications. Sally was 35 when she experienced a bowel perforation and was diagnosed with vascular Ehlers-Danlos syndrome. She has 3 children, 2 daughters and a son, 2 siblings, and her father passed away also due to what was probably complications of vascular Ehlers-Danlos syndrome. So when Sally was given this diagnosis, she wasn't aware of a history of vascular EDS running through the family, so this was an out of the blue diagnosis for her. So we told her about the medical implications and also the inheritance patterns, so what this means for the rest of her family members. So a 50-50 chance of passing it on to her children. And as has been explored and discussed and highlighted by many people today, there are lots of responses and individual reactions to this genetic information, both on a practical level in terms of making plans for follow-up and management, scans, medication, adjusting lifestyle, planning for an emergency situation, thinking about the physical limitations after her bowel perforation, and some of the implications of her joint hypermobility. And also the question around family. Is she going to have more children? Who does she tell? Does she tell her friends? Does she tell her family members? Does she need to tell work about this diagnosis? And a whole plethora of emotional responses that come with a diagnosis. There isn't much data out there around the psychosocial implications of a diagnosis of vascular EDS, but this study by Leanne Barrett will be published soon, and if you want more detailed information, it is published on the Annabelle's Challenged website. And these are the main themes that came for qualitative interviews with 21 patients affected with vascular EDS. And I'm sure those themes will resonate with lots of the people here. So Sally, as well as getting her head around her own diagnosis, was also very conscious of what this meant for her family and very much wanted to share the information with her relatives to alert them to the medical implications so they could access testing and appropriate management. But she didn't have much contact with her extended relatives. Her father had passed away, and with that she'd lost contact with his side of the family. And it was on his side of the family that there was a relevant history, likely due to vascular EDS. So what we did with Sally was to provide support in a number of ways, really. And whenever we see anyone in the context of genetic counselling, we have central tenets that we always keep in mind. The first of which is that genetic information is key. The other is that emotions matter. They're important, and they should be explored, and we should be alongside people with their emotions, and that people ultimately are resilient. So there are a number of barriers that Sally faced when she was thinking about sharing the information with her family members. Few of them related to informational barriers, so she needed to understand her diagnosis, both in terms of what that meant for her, the genetics and the inheritance, so she could understand who needed to know the information. And we worked alongside her to clarify that. So there were some people in her family tree that she thought didn't need to know because they'd got to the age of 60 or 70, and she thought if they had vascular EDS, they may not they wouldn't have got to that age, when in fact it was relevant for some of those relatives. Another emotional barrier was the worry about passing on very difficult information, and she wanted to protect people, particularly her children, from difficult information. As well as thinking about the rifts and the barriers and the emotional kind of and the dynamics in the family that acted as a barrier. So one of the main things was really to allow Sally some space and some time to get her head around this diagnosis herself, and to normalise that it's okay not to disseminate information immediately. I mean, there are circumstances where it does need to be immediate, but generally people need that space to make sense of their own personal risk and have a period of deliberation to make decisions around disclosure. So the who, the what, the where, the whys, the hows. And so for Sally, the main thing on her mind and the biggest worry that she had was sharing the information with her children, who varied in age between the ages of 6 to 16. And initially she wasn't keen to disclose because she wanted to protect them. And she particularly had questions around whether Marcus needed to know, who was 6. And what we found from the psychological literature is that actually children tend to adapt and cope better with this information if they can receive it in a drip-fed way over time. So even starting from the age of 5 or 6, giving information in an open and honest way, in an age-appropriate way over time, does result in better outcomes for people. And this is highlighted by a quote of an adult with a different inherited cardiac condition. And I'll let you read that. And they're just explaining that they received their diagnosis in adulthood, and that meant they had to make big adjustments to their lifestyle. And it all came very much at once, and it felt like a very brutal way to receive the information, whereas if you can gently do that in a safe environment for children, they tend to cope better. I have a lot more literature, and there is a talk again on the Annabelle's Challenge website around that, and tips and ways to support parents and how to go about communicating with the children, but I don't have time to go through it now. But essentially the literature shows that at no age do children let the condition monopolise their lives. And the take-home message for parents grappling with this difficult negotiation and navigating communication is that you are the expert. Not only are you the expert in yourself and your condition, you're also the expert in your family and your children. It's okay to take some time to look after yourself as well, and have a phase to explore support for yourself, to feel more comfortable and confident to share the information. And please draw on support. Genetic counsellors, if they're available to you, will be very happy to talk you through this process, maybe even role-play discussions with you, make plans for any disclosures that you make. And the central tenets of genetic counselling, I think, also apply in this context for parents, to know that information is key, and if you don't understand something, do ask. Emotions matter, so exploring some of the difficult emotions is okay. And ultimately, children are resilient. And some of the studies show that parents overestimate the impact that this information has on their children, whereas children show resilience and often say, actually, I wanted a bit more information from my parents. But ultimately, please do ask for help and reach out for support. Thank you very much for listening.